Good morning. My name is Anita Poulson and I'm with the Florida Department of Health. We're very excited today to be able to partner with CHN for this year's Children's Environmental Health Day. We hope that our presentation can help raise awareness of the importance of children's environmental health. Today I'm going to present a new initiative that we've been working on in Florida. It's called Florida Choose Safe Places for Early Care and Education. And this is an initiative to help make sure that children in Florida are safe from environmental exposures, such as chemical contamination while they're in care outside of their homes. I'm a health risk assessor in the Hazardous Waste Site Health Risk Assessment Program in the Bureau of Environmental Health. We are in the Division of Disease Control and Health Protection at Florida Department of Health. We're a team of 5 people, including my supervisor and program administrator, Gladys Lear. Then we have 3 health risk assessors, including myself, Jessica Forbes, and Olaf Sarkin. And then we have a health educator, April Crowley. And we all work together on this initiative. Before I start the presentation, I want to just highlight a few terms. Choose Safe Places for Early Care and Education is a very long name, so you will see it referred to as CSPECE, and I will refer to it as just Choose Safe Places. You will also hear me refer to early care and education programs as ECE programs, and with that I refer to any childcare facility, center, or family childcare home. So the content of today's presentation is going to be an overview of Choose Safe Places, what it is and why it's important. And I'm going to go over some of the considerations that we make to help evaluate if a location is safe. Then I'm going to give an overview of how you can participate in Florida Choose Safe Places and what the benefits of participation are. So what is Choose Safe Places? Well, Florida Choose Safe Places is not the only Choose Safe Places in the United States. Choose Safe Places was created by an agency called the Agency for Toxic Substances and Disease Registry, or ATSDR. And they found that there were some limitations to current licensing regulations to fully ensure that ECE programs are located in safe places away from chemical contamination. And they wanted to make sure that children are not exposed to dangerous chemicals during their care, because chemical exposure can lead to health risk. So in Florida, we are one of 28 state programs across the United States who are funded by ATSDR to create our own Choose Safe Places initiative. The mission of Choose Safe Places is to make sure that ECE programs are placed on safe sites. And we do this by providing tools and resources to help evaluate such facilities and their surroundings. The goal of Choose Safe Places is to help professionals across various sectors come together to collaborate to create safe practices in their communities and surroundings. So ATSDR encourages our state programs to work together across public health, community planning, licensing, environmental protection, early care and education, and any other field that's important for childcare licensing and siting. And the mission and goal of Choose Safe Places very much align with the mission of the Florida Department of Health, or FDOH. Our mission is to protect, promote, and improve the health of all people in Florida through integrated state, county, and community efforts. So that brings me to Florida Choose Safe Places. We are currently in our pilot phase. Our initiative is voluntary. It's not a regulated program. So once we're fully implemented, providers will be able to request an assessment of their location. And it could be something that a new provider want to do before they decide on a location, or it could be an existing provider who wants to confirm that their location is safe. We work on a recommendation basis. We do not tell people what to do. We don't close businesses. We're really here to provide recommendations to help protect ECE providers and the children in their facilities from potential environmental harm. And we provide recommendations to help providers and parents make safe choices when they choose a facility or a location for a facility. We have many partners in Florida. We get advice from many different government agencies and non-government organizations, and this is to make sure that we provide the best recommendations and perform the best assessments possible. So we receive advice from other programs within the Department of Health, and then we also have partners in government agencies outside of our own. A very important partner is the Department of Children and Families, DCF. They are responsible for childcare regulation and licensing in 62 of 67 Florida counties. The other 5 counties have local licensing authority, but they have to adhere at a minimum to the regulations by DCF. And we also work closely with those 5 counties. We also partnered with the Department of Environmental Protection, who are responsible for hazardous waste cleanup sites around the state, and we use their databases to help us find out if there could be a cleanup site of concern nearby a childcare facility location. And then we've partnered with the Department of Agriculture and Consumer Services, who are responsible for pesticide regulation in the state of Florida. Then, of course, we also have non-governmental partners, and we receive advice from organizations responsible for childcare research and training. So why is Choose Safe Places important? Well, you may know this, but children are the most sensitive population when exposed to environmental hazards. They're growing and developing, and those processes are very sensitive to disturbances, including chemical exposure. While children are growing and developing, they also eat and drink more relative to body size compared to an adult. So if an adult and a child drink the same contaminated drinking water, the child will be exposed to a higher amount of chemical than the adult relative to body size. Then, of course, there's the behavior and size of children, which bring them closer to the ground. And when you're closer to the ground, you are more prone to exposure to contamination in dust and soil if it's there. And of course, children, they like to play in the dirt, they like to get their hands dirty, and then they also are not afraid of putting their fingers in their mouths afterwards. So unfortunately, this also makes them more susceptible to become exposed to chemical contamination. And then we have to consider that children spend a lot of their time in a care setting outside of their homes. When we adults go to work, we often send our children in care somewhere outside of our homes, and that's a lot of hours every week. And so in the same way as we want to protect our children by making sure our own home is safe, we want to make sure that those care settings outside the homes are safe. And we have a lot of children in the United States. There are more than 8 million children less than 5 years old who are cared for in a licensed ECE program. In Florida alone, we have more than 1 million children aged 5 and less. And by the end of 2019, we had more than 10,000 licensed ECE programs. So that's a lot of ECE programs and program locations to keep track of and make sure that they are free of environmental contamination. So when a childcare provider applies for a permit to open a new facility or childcare home, of course they have to meet certain licensing regulations. And there are lots of requirements to meet. But these requirements don't fully address chemical contamination or environmental contamination. You have to consider that contamination is not always visible, you can't always smell it, and it may have occurred a long time ago and left contamination behind that has just persisted. So unless you really look into this, unless you really investigate, you may not find it. So even if a childcare provider meet all current licensing regulations, it is not 100% sure that that program isn't located on or near a place with chemical contamination. And that could be a place that produce or use or dump harmful chemicals. It could be occurring now, maybe nearby, or it could have happened in the past and left chemical contamination behind. Unfortunately, this has happened in the past, that childcare programs have opened up in contaminated places. One example was a facility that opened up in an old mercury thermometer factory. And unfortunately, the building still had mercury residues in it. And it wasn't until 2 years after the facility opened that it was discovered that children and staff have been exposed to high levels of mercury. And this is the kind of situation we want to prevent. We want to make sure that children and staff aren't exposed to harmful chemicals in these care settings. And we want to make sure that ECE providers don't end up in a situation where they thought they had opened up in a safe place to then realize later that their building or their property is contaminated. But aside from these kinds of contaminated sites, it could also be that your building has naturally occurring radon gas seeping into it. Or it could be that you use a well for your drinking water supply, and maybe that well became contaminated from a location elsewhere. And those are all things that we consider when we perform an assessment of a location. So on this slide, I have listed some of the main considerations that we make when we assess a location. We look for certain items of potential concern on or around the property. We assess the playground cover, drinking and irrigation water, if there are any nearby businesses that could be of concern, or if there were any activities on the building, in the building or on the property in the past that could have left contamination behind. And then, of course, there are other things that you can do than look at the location. And I'm going to go over a few things at the end of these slides. So here are some examples of items that could be of concern. We don't like to see metal drums or barrels lying around on childcare properties. They could have been used in the past to store some sort of solution or material that contained chemicals, and that could have left residues behind. We also don't like to see old cars or vehicle parts, discarded white goods such as old appliances, or construction and demolition debris. All of these items could hide chemical residues that children could get exposed to, not to mention all of the sharp edges and other things that you could hurt yourself on. If there's a barn on the property or some old farm equipment left behind, well, that could indicate that there was agricultural activity on that place in the past. And that could indicate perhaps that some chemicals were used on the property. And then, of course, we don't like to see batteries, paint cans, and syringes lying around. Here are some examples of playground cover. And this is not to say that any of these covers are bad in any way. And of course, these are very fancy playgrounds. Not everyone has a fancy playground like this in their on their childcare property. But when we look at playground cover, it's really to find out what that cover, what it's made of. And it's really for us to find out, in case that we find some below ground contamination, then we are ready to assess if that cover is sufficient to protect children and staff from exposure to that contamination below ground. And that's, of course, only in the case that we would find something. Then we consider the drinking and irrigation water. We ask the provider what drinking water source is used on the property. If it's a municipal water system, such as city water, public water, then it must meet certain drinking water standards, and it's regularly tested. So we feel this water is generally safe. A private well system can also be perfectly fine. You can get very nice drinking water from a private well. But the testing is generally the owner's responsibility. So we make sure that that water has been tested and that it has been tested recently, because contamination can move. And so you could have nice, clean water today, and then in a year or 5 years from now, it may look different. It also depends what kind of, what the purpose is. Is it a drinking water well? Is it an irrigation water well? The risk of exposure is going to be different if it's for drinking or if it's for irrigation. But that's not to say that irrigation water doesn't need to be clean, because children play in sprinklers. They may drink that water. They may roll around on a wet lawn after it's been irrigated. So of course, that's another way. Those are other ways that you can come in contact with contaminated water. So we just want to make sure that it's okay. Then we look for nearby businesses. It could be businesses in the same building that may not be so practical or healthy. For example, if you have a childcare program inside a strip mall, you may not want to share walls with a dry cleaner or hair and nail salon. Any business really that could produce unhealthy fumes, because those fumes can move from one room in a building to another. We also consider businesses that may be on the same parcel, or on the next door parcel, or across the street. And it really depends on the situation if it is going to be a concern. We look for different kinds of businesses. This is not a complete list of possible businesses, and it's also not a list of businesses that are always going to be a problem. We just consider any business really that either use hazardous chemicals or that might generate some sort of contamination that could be or become a concern later. Then we look at the building history, and that's because we want to check for the potential for radon, lead-based paint, or asbestos to be in the building. Radon is a naturally occurring gas. It can seep into your house from below ground, and you can't see it, smell it, or taste it. But it is the second leading cause of lung cancer in the US. In Florida, testing is a requirement for licensed early care and education facilities in 48 of 67 Florida counties. But we have found that when we test homes in Florida, 1 in 5 homes have had high radon levels. So we do recommend that everyone test for radon. And I'm not going to go into more detail today, because I know that our colleagues in the radon program, or radon and indoor air, will be presenting later today at noon. So I'm just leaving you here with a website to Florida Department of Health's web page for radon. Then we consider lead-based paint. This was quite common until 1978, both to paint houses on the inside and on the outside. And over time, paints do deteriorate and they create dust. And unfortunately, lead dust is one of the most, or is the most common cause of lead poisoning in US children. And because lead is a neurotoxin, it can affect the brain. And we do know that lead exposure affects brain development in children. So this is something we really want to prevent. We really do want to avoid that children get exposed to lead. So we initially check if the building was built before 1978. Was lead-based paint used? Was that paint removed, or has it been covered? And if it was covered, what is the condition of that cover? Then we check for asbestos. Many of you probably know that asbestos is a material that creates these very small fibers that can get into people's lungs. And inhalation of those fibers can unfortunately cause cancer. It's very carcinogenic. It was particularly common in building materials from the 1950s through the 1970s. But production and use have particularly declined since '89 when a ban was attempted for asbestos. It really led to increased awareness of the problems with asbestos. So we check first if the building was built before 1989 and if the building materials could contain asbestos. If it does, is that asbestos contained properly? Because if it is contained properly, there is no risk of inhaling these fibers, and then there's no problem. If the asbestos was removed, then we want to make sure that it was removed by a certified abatement company, because you're never supposed to try and remove asbestos or lead-based paint on yourself. You really need a professional company, and this is to make sure that all residues are removed. Then finally, we look at the property history, and this is to make sure that there weren't any previous activities on the site that could have left contamination behind. And again, we are looking for some of those same buildings as I mentioned before. So this was some examples of considerations that we make to evaluate the safety of a location. But there are, of course, many other ways that you can improve environmental safety just in your daily lives. For example, as we've all learned with COVID, hand washing is good. You can increase the hand washing of staff and children. You can leave your shoes outside. You can make sure the floors are clean and free of dust. You can avoid using fragrance and chemical products. And if you need to use chemical products, then of course we recommend that they're stored safely away from children. And when you use them, choose a time where you can air out afterwards. For example, you may want to use chemical products on a Friday afternoon after the children have left. And then you have the whole weekend for the building to air out. If you have any regular poor outdoor air quality, you may want to evaluate the outside before you let the children play. It's possible that there are certain times of day or times a week that it's better to play outside than others. And then we recommend that you avoid noise, because noise pollution can also be unhealthy for children. So how can you participate in Florida Choose Safe Places? As I mentioned, we're currently in the pilot phase. So at this time, you can participate as a pilot participant, and we do have room for more pilot participants. Our pilot testing includes the same components that we plan to offer in the future, so it does qualify as a full participation in the initiative. And we do offer certificates of participation to all of our pilot participants. Once we've implemented Choose Safe Places in Florida, childcare providers will be able to select from several components. We'll be offering training, and that'll be available through DCF's mandatory training for providers. We'll be offering an environmental health self-assessment survey, and this is a form that goes through those location considerations that are presented today. So you can use that form to self-check your location, or you can submit it to us to receive a professional evaluation based on your survey responses. And then finally, you'll be able to request a more in-depth comprehensive evaluation by us. So you can really tailor this initiative to your own preferences. Each provider can choose what level of participation they would like and what level of assessment they would like for their location. And we do encourage providers to contact us and receive and request an evaluation. This is going to be a really great opportunity to confirm that your location is safe. And we certainly hope and anticipate that most childcare locations in Florida are going to be safe. This is just an opportunity to find any concerns that could be associated with a location. And I want to highlight again that we're not a regulatory program. We don't tell people what to do. We work fully on a recommendation basis. So if we find anything that could be of concern, then we'll provide recommendations to help the provider improve the environmental safety of that location. If you're a parent or other community member with interest in Florida Choose Safe Places, then you can encourage providers in your community to participate. We do have limitations. Our recommendations are based on limited resources and professional judgment. And we're going to try our very best to identify all possible environmental hazards associated with a location. But we can't guarantee that we're going to find everything. And we can't offer any financial assistance to cover any cost that could be associated with recommendations we may provide. We also like to remind our participants of Florida's public records law. You may know this as the Sunshine Law. It was first ruled in 1909, and it's written in Chapter 286 of Florida statutes. It means that any records that are submitted to us or generated through an investigation by us is available or will be available for inspection if anyone requests it. So that could include papers, maps, books, tapes, photographs, films, sound recordings, and records stored in computers. So that could include also emails. The benefits of participating in Florida Choose Safe Places is that you can help protect children and childcare staff from environmental hazards. And if you participate in any of our trainings or you fill that environmental health self-assessment survey, then you can also learn something new. And then, of course, we offer certificates of participation for all of our components. So that concludes my presentation today. The next slides are going to include some references that we used in our presentation. If you would like a copy of these references to look at anything in more detail, you're most welcome to contact us for a copy after this presentation. And this is my final slide. I've included our contact details. As I mentioned, we do have room for more pilot participants. So please contact us after this presentation if you would like to participate in this initiative. You're also very welcome to contact us if you have any questions, want to learn more about Choose Safe Places in Florida, or you may have some specific questions about your location that you would like some help evaluating, and you're very welcome to contact us about that as well. Our email address is choosesafeplacesflorida@flhealth.gov, and our phone number is 1-877-798-2772. And I've included the link to our webpage for Florida Choose Safe Places. On this site, you can find our fact sheet and our annual reports if you want to read more. And then on the bottom of this slide, for those of you outside Florida who would like to know more about Choose Safe Places in other states, I've included ATSDR's link for Choose Safe Places. So with that, I would like to thank CHN for welcoming us to give this presentation today. And I'd like to thank everyone who listened in for your attention and for participating in Children's Environmental Health Day. Thank you.